there's going to be a physical manifestation of your mental, emotional, psychological trauma. Whether it's a disease or a fall off a ladder or a snowboard injury, it's just a physical manifestation of the imbalance that's happening on a psychological and emotional level.
That's what I find interesting, is different people are impacted differently. There's an individual response to trauma and spiritual trouble and psychological trouble. And so not everybody responds the same way.
A snowboarding accident that threw out my back is only one physical manifestation of the emotional, mental, spiritual trauma.
Hi, Candice.
Hi, Tam.
Good to see you.
Good to see you.
Thank you for coming on to my podcast.
It's really going to be an interesting chat.
Okay, good. Well, maybe just to start off, could you tell me what inspired you to go into osteopathy and also massage therapy?
Yeah, so massage therapy actually came first, and it started in a very interesting way because originally I had moved to Toronto to pursue art school, which was really a dream that I'd had for a long time. And then when I moved to Toronto, I realized very quickly that when I went to OCAD to go for the information session, that it felt like it was beyond my capabilities at that time. And so I got a bit discouraged, and I started working in the bar and restaurant industry. And I met one of my managers named Vince, and he, out of the blue, out of nowhere, because it was a big bar, there was about 200 people in this bar staff.
Staff?
Yeah.
Oh, wow. Yeah.
It was like a 3,000 capacity club. Mm-hmm. And so, you know, we know people through the work life, but I didn't really know them. Mm-hmm. And so Vince one time came up to me randomly and he said, "Oh, would you like to be a demo client for me at my massage therapy school?" And I didn't really know him, so I thought it was interesting that he asked me. Mm-hmm. And then I said, okay, sure. So that brought me to Sutherland Chan, and I got to experience it from a client perspective. And I was like so intrigued that this was somebody's profession, and that I don't know, it just never really occurred to me that a massage therapy was a way to go. And so, yeah, I think that September I enrolled in Sutherland Chan. And so that brought me to my massage career, Vince. And I don't know where he is or what he's up to now, but I think he did stop doing massage therapy. So it just felt like he was the one that kind of stirred that pot.
And how long were you a massage therapist for?
I did that for, I think, 13 years.
Oh, is that right?
Yeah.
Oh, yeah, so for quite a while.
Yeah, and I started, I did the acupuncture program at McMaster.
Right.
Kind of in between osteopathy and massage. And then I just felt like after 13 years that there wasn't a longevity in that career.
Why was that?
I definitely felt that my size was a big challenging point for me, because all of my clients were quite larger than me, and I felt like I felt like I was expending a lot of energy and it was taking a toll. And so I wanted to find something where I could stay in the same realm and still run my clinic and my practice, but like be able to do something a little bit less repetitive and less forceful. And so osteopathy kind of was able to bridge that gap for me.
And that was a big undertaking to study osteopathy.
Yeah, and osteopathy came to me when I was about 25 through you.
Oh, right.
Interestingly enough, you actually brought me to a couple of your treatments with with an osteopath. And I remember sitting in the waiting room, waiting for your treatment to be done, and just looking at that gentleman's diplomas and degrees on the wall, and osteopathy being one of them. And I just thought, like, at that moment, I thought, I think it just felt like like a spark in my mind that might one day be something I would pursue. And then that's kind of the natural progression that it took. And so in Canada, osteopathy is very different than in the U.S. And so it's one of the schools in Canada, the one that I went to, the Canadian College of Osteopathy, it had the most extensive program. It was a 7-year program. And I remember, like, opening that door on the first day and thinking, like, wow, this is like the first day of the next 7 years of my life.
Right, right.
And it was a huge undertaking, and the thesis component was like a whole other thing that you had to jump through after already completing 5 years of study. Like, you know, you were already so burnt out from the 5 years of study, and you still had to hammer out another 2 years of thesis writing. So it was a big program, and it's very different. Like I said, it's very manual therapy in Canada, and where in the U.S. it's they become medical doctors first, and then they specialize in osteopathy.
Now, does the osteopathy, the practice of it, is there similarities between Canada and the U.S.?
I think yes.
Yes?
Yeah, definitely.
Right. It's just where you come from is different.
Yeah.
Yeah.
I do think in the U.S., I mean, I'm not 100% sure, but I do think that a lot of the D.O.s in the U.S., maybe they don't have the same level of manual therapy hands-on experience.
Why would that be? If that was true, why would that be?
I think I'm not saying that it's like all of it, but like I think some are maybe acting a lot more like on the medical,
I see.
Western medical.
Yeah, I guess that depends on the person.
Yeah,
right?
It depends on the person. So they do act as a doctor. They
yeah.
prescribe medication and all sorts of things. So,
I see. Right, right, right.
Whereas in Canada, we're just manual therapists.
Yeah.
Yeah.
Right. Now, recently, in the last couple of years, you were hired by a tennis player to go on tour with her.
Yeah.
Yeah. What was that like?
That was...
And how did you help her?
Yeah, that was a very interesting scenario. I felt like so, what's the word? Like, I just felt like, wow, like this is such an amazing experiential opportunity for me. And I was really blessed that, A, that it came into my field, and B, that she trusted me to take care of her in like the most, in a very intimate way, yeah, and
say,
you know,
yeah.
in the tennis world where it's quite competitive.
Now, so you were there working on her team.
Yeah.
Did she have any other manual therapists? Or
No, I was the the only one.
Mm-hmm.
Yeah, so
How did she find you?
I had so when I was in osteopathy school, one of my teachers, who I remained friends with, he was the one that referred her to me. He was her osteopath, but he wasn't able to go on tour. So
I see.
He referred her to me, and then I went and gave her a couple treatments in Toronto, and I really exponentially helped her back issue at that time with those treatments, and something that had been keeping her away from tennis, and then she asked me to go traveling with her.
How long did you travel with her for?
It was kind of on and off for period of 3 or 4 months. And I went to the U.S. Open in New York.
Oh, yeah. What was that like?
It was amazing.
Was it large? There were lots of people there, I imagine.
Oh, yeah.
Yeah.
It was packed stadium, and all the players from the tennis association, like all the men and the female competitors. So all the big players were there, and so I was.
Did you meet other manual therapists then?
Not really, because in that world, it's like.
Everybody's separate.
Yeah.
I see. Right. Not giving away any secrets. Yeah, right.
Yeah. So, I kind of I went with her basically to every training practice, every gym training with the trainer, and went to every different movement practice that she had. And I was just always there and helping her with issues along the way, giving her treatments before games and after games, and it was pretty full on.
Yeah, I remember how excited you were.
Yeah, it was fun.
Yeah, it was really fun.
It was good because I got to travel and experience the world with osteopathy.
Yeah.
Yeah.
Right. So let's talk a little bit about osteopathy itself. And how it came to be, and who it started with.
Yeah.
Let's talk about that.
Okay. So Andrew Taylor Still is the founder of osteopathy, and he was born in 1828. And I think he lived a pretty full life. He had a father who was a Methodist minister, and a mother who was like a home caretaker and a mother. And he grew up in so his father was also a doctor, so he learned a lot of medical stuff from his father, and also a lot of religious upbringing as well from his dad. And he was always a very curious man, a bit of an inventor, very good with mechanics, and he spent a lot of his time sort of in frontier life, and he worked a lot with machinery, and he was very good with understanding the inner workings of things. And so I think it was through that kind of mind where he had just like that ability to conceive concepts and work with mechanism. So that was sort of his upbringing. I mean, he did state in one of his books that, like, when he was a kid on the farm, like working with a plow line, he used the line, like rested his head at the back of the line to relieve a headache.
Oh, yeah.
And he said that, he quoted that was his first encounter with osteopathy. So, and then, so he followed with kind of within his dad's footsteps in terms of learning a lot about medicine. And then he realized with his daughters, he had I think 3 daughters, and 2 of them died of meningitis. And it was at that moment that he realized that allopathic medicine didn't seem to be the way.
It has its limits.
Yeah.
Yeah.
He felt like it really, it had its limits, and he was a little disgruntled and discouraged by it. And so I think because he had such a good relationship with God and a spiritual practice, that he felt that God had already given us our innate healing ability, and that he wanted to kind of prove through osteopathy that it's possible for self-healing, self-regeneration, that if given the right circumstances, that the body can heal itself. And that was sort of the lens in which he created osteopathy. He also had a lot of native influence in his community and spent a lot of time learning about their healing practices and their natural remedies. And he did a lot of dissection on native grounds, in burial grounds, and really took apart anatomy and really learnt anatomy through that. And it was through those expressions that osteopathy came to be. And he also kind of delved a lot into spirituality, like through his dad. Also in that time frame, spiritualism, sort of mind, body, soul connection was also like kind of happening in that era. And he really went into that through into that realm. He really went into the spiritual realm.
Yeah. So the medical, he went into the medical through the spiritual realm.
And he wanted to combine the two. His idea was to be sort of a radical combination of the art of medicine and the art of spirituality.
Right.
Yeah.
So he must have, when his daughters died, I imagine that he questioned medicine and where they were getting their information from.
Yeah. And kind of in and around that time, around 1910, there was a really strong influence from government in terms of diminishing alternative practice.
I see.
Yeah. And it was through the Flexner, they call it the Flexner Report, and it was through this that they were really trying to, I guess in our days, call it cancel. They were really trying to cancel alternative medicine, including homeopathy and herbalism and those kinds of practices. They really wanted to push for the allopathic Western medical way.
Yeah, so it says the Flexner Report examined medical education and suggested reform to medical colleges, including standards, partnering with hospitals for clinical training, closing schools that could not afford to update and maintain. So they were just trying to make it the same across the board.
Standardized.
Yeah.
And so with that went a lot of the spirituality.
Right.
Because osteopathy had to conform. And with it, it was more of a kind of standardized science-based medical practice.
Right. And so then in your practice, when you do osteopathy and someone comes in, it's not just a standard. In massage therapy, you'll start with like effleurage, so you'll go through the whole body and then you'll find the places where you think there's trouble and you'll go to them. But it's pretty standard the way that you start and everything. Is there a standard way that you begin in osteopathy?
Oof,
or do you decide that on your own?
Yeah, I would say osteopathy is pretty individualized.
Yeah, right from the get-go.
It seems that way
because when I've come to you, you start the same way every time.
I do, yeah, because I've kind of formulated my own way of doing it.
Oh, I see. So now that you do this with every client.
Yes.
So every practitioner kind of has their way of doing it, but it's standardized within their own practice.
Yeah.
I see.
I'd say so. And osteopathy is interesting because there's such a broad range of treatment styles. And so some osteopaths, we call them structuralists, and they're very mechanical. They perhaps do a lot more adjustments. They're very mobile, like they do a lot of mobilization. The treatment is kind of quite dynamic and there's a lot of movement and engagement happening. And then on the other end of osteopathy, it can get very subtle and energetic, fluidic. And so that realm can be very, like the nuances as a patient might not really get, because it is so subtle. Mm-hmm. But in those subtleties, you're able to make changes on the structure. You're just coming at it from a very different approach. And so there's just like all of that gray area in between.
Right. And so then when you start with somebody in an energetic manner, what are you paying attention to?
Oh, that's such a big question. And
some of those terms that's still used.
Yeah.
Right. So can you bring in some of those terms?
Yeah, the terms.
I was very interested in that.
The biogen, electromagnetism. Mm-hmm. He used,
life force,
energy, nerve force energy.
Yeah, I don't understand all those things. So.
Yeah, still used a lot of words. He definitely talked a lot about God. Mm-hmm. If you want to start at the highest form, you start at God or universal energy or nature with a capital N, whatever word or vital force or life force, whatever force you want to call it. Do
you start with that?
You are interfacing with that mechanism.
So what's your first intention when you start to work with someone?
My first intention is to really get a read on who this person is and how their body, their physical manifestation.
And are you using life force or nerve force or God, or what are you using there?
It's sort of...
Or is it all those things?
It is all those things.
I see.
It is all those things, and if you want to get more to like the physical matter of you in front of me, like you want to see, like, if you want to consider us as energetic beings, which we are, how are we existing in the world around us? And so when I'm touching, let's say when I start at the feet and I'm doing my initial sort of diagnosis, I'm trying to see like how your body is in space. Like, so it's as if I'm sort of cycling through a lot of different protocols in my mind. Like, so you have like the physical body. So sometimes in the physical body there are biomechanical issues, right, of the spine or of the joints or whatever. So that has a presenting palpatory sense. So it's like everything is very palpatory.
And so would you feel in the palpation, there's movement or there's no movement?
Yeah.
There's restricted movement?
Yeah, there's restricted movement, there's movement or no movement, or there's just like a density, or there's a lack of flow, there's a lack of fluid, there's a dryness, there's maybe a shear, like, so there's an energetic pattern to a shear.
Yeah, it keeps going in one direction.
Yeah, exactly. And then you want to see you want to look at how the body is either absorbing ground reaction force. So we're always being impacted by the ground, and how our body absorbs that force and how it is transmitted through the chain from feet up. And then we're always looking at how the body is compensating for gravity or the force that's sort of always pushing us down. And so biomechanically, we're always working against those two forces and trying to absorb them and then again stay within our center. So we're looking to see like how the body is decompensated or compensated towards those two.
And you can see that when someone is laying down and you put your hands on their feet.
Well, I feel like I've developed over time that sensory perception. I mean, it's taken many years to kind of like learn that palpatory skill.
Yeah, I believe you. I remember just going into massage therapy, and we started at the same time, so we've known each other a long time. They would tell me to palpate, say, the back and the certain muscles on the back, All I could feel was skin.
Yeah.
You know, I couldn't feel anything when I
Right.
first began. And it was through practice that I could feel the structures of the body and the interplay of the breath with the body and
Right.
and the heat and the cold and all of the and the rigidity and
Yes.
the softness and all of that stuff. So you like the practice of anything, you become mature, you become informed.
Yeah.
And then you can and depending on your, I guess, intuition.
Yeah.
Also.
Mm-hmm.
And your openness.
And your intention.
Yeah, your intention. And I've been talking with my husband about intention, and we were talking about how intention is the first thing of an idea or a movement. And so if the first intention isn't with what is highest, then you're going to go in a direction that's not that direction.
Right.
Yeah. That's why I was asking you what the first intention is
Right.
at the feet.
Okay, well, yeah, I mean, the first intention too is like, okay, you're right. So first as an osteopath,
Mm-hmm.
you have to have your own good intention.
Right.
And you have to connect within, let's call it God. You have to connect within, or love.
Yeah.
You can call it love.
Yeah.
With the love inside yourself.
Osteopathy calls it love, right?
There is love.
Or some of the people I read about in your thesis.
Yeah,
love.
still called it love too. The late James Jealous talked a lot about love as well.
Mm-hmm.
And
I think love is the right intention.
it is the right
and it's
intention.
less vague. God is kind of vague.
Yeah,
I mean, it's and we can't see him, and we can't. You know, there's a lot we don't know.
yeah,
But love is something we can understand because it's really at the human level.
exactly.
Isn't it? Yeah.
And so, so let's say that you connect with your intention to act from a loving place.
Mm-hmm.
And then you connect with your client, and to make a change in osteopathy, it's a dialogue between the universal love energy that exists all around us, plus the love energy within my own being, connecting with the love energy within your being. And so that's sort of the first dialogue, because you really have to I have to kind of come into contact with your mechanism, with who you are, Tammy, in this moment. And so that sometimes takes a little bit of time, because
Some people are guarded.
Some people are guarded, some people are blocked, some people are not ready to let go, some people are not ready to receive, some people, all of those things, right? So sometimes it does take more time with others than it does with some people that are more open. And so that's really the first step,
Right.
is to engage with the mechanism.
So let's talk a little bit about life force and nerve force. Can you explain what those are?
Yeah, so you could call love as also the same
Oh, yeah?
thing as life force.
Okay.
Or you could call it chi, or you could call it like the universal energy or God energy. There is an energy in this world that pervades this space in between us, right? There's light energy.
You wouldn't call it something if it wasn't something. We call it space.
Yeah.
Right?
Yeah, it's like a void, but within this void is sort of like a soup of energy. Like, I don't know exactly, but I thought
You can walk into a room sometimes and you can feel uncomfortable, or you can feel relaxed. Yeah.
Yeah.
Right.
So there's...
what is that? You know, that's not easy to understand.
Yeah. And so within that energy between us, that is sort of where the potency or the force, the life force, the vital force is in this space.
So potency and life force and love,
Yeah, it's all kind of...
they're all related.
Yeah.
Okay.
And so it's in charge of our self-healing mechanism, like our self-healing and our regeneration.
Right.
Is this energy that exists. So in osteopathy, we create the platform and the environment for this energy to come through and dissolve the strain or dissolve the dysfunction or whatever it is that the symptoms that you're treating. It has that ability to transmutate like lead into gold, let's say, alchemize.
Right.
It's very complicated.
But that is what love, that's
what
powerful
love does,
is.
right?
That's how powerful it is.
Exactly.
Yeah.
Exactly. So it's, so an osteopath is sort of acting as that fulcrum to allow the passage of this energy to enter to the patient.
And I don't get that. You tell me more about the fulcrum.
Yeah, so it's a big concept.
It is. And I know what a fulcrum is. It's like a teeter-totter.
Yeah.
The structure underneath, that's the fulcrum.
That's right. And so the fulcrum provides the point at which you can sort of move a large object with not a lot of weight, because there's this
so do you position yourself on the individual close to the fulcrum so that you can have movement far away without very much?
No, it's more like, okay, so let's say I have you in front of me and I'm doing an assessment and I see like, oh, Tammy's knee is blocked. There's no life in it. There's no movement. I don't find any spring or elasticity. It just feels like something's going on there, right? So what an osteopath does is, in treatment, is a lot of our treatment is done with our elbows anchored, so either on the table or leaning up on something, so that and let's say I'm holding your knee and my elbows are stationary and I'm in my center, because I have to be in my center to create a good fulcrum for you to change. So so we have this system where my elbows are anchored and I'm holding your knee and I've created my own fulcrum within myself.
Is that through breath?
It's through connecting to a higher source, like to my center, let's say to love energy.
Does breath have anything to do with it?
I mean, it would be best to have just a normal breathing parameter, but I don't like, I wouldn't be holding my breath or anything.
Right.
Yeah.
And what about cerebral spinal fluid in the treatment? I know that's very important.
Yeah, so let me just finish with this fulcrum.
Sure.
So the fulcrum that I've created for you, setting up the parameters to create this fulcrum, is basically like a place that allows your body to unwind the tension in the structure. Like almost as if, you know, when you have in the olden days when we used to have telephone cords and the telephone cord would get all wrapped up and wired up. But
and you'd have to let the telephone
all you
hang
have to do,
unspin it.
Yeah. But what's unspinning it? It's like that coiled up energy within the telephone cord, right? So as I'm holding the telephone and it just unwinds, it's kind of a similar analogy.
And so in the holding of the structure, are you offering it a comfortable place to unwind from?
Yes.
Oh, I see.
And sometimes, so like you're offering it Yeah, and the fulcrum is here, but also there are fulcrums within the body of your body. There's fulcrums. So and sometimes the fulcrum shifts. So there's like an overall strain pattern within your body, and underneath those strain patterns are other patterns, right?
Mm-hmm.
Like a telephone coil. Like it's a coil, and then it's coiled in, and so sometimes I'm there holding for a long time because I'm releasing individual strain patterns underneath those strain patterns, and sort of following the body and the movement of where things sort of the next in line with the next part that's holding that knee dysfunction. Because sometimes...
And it might come from your shoulder,
Yeah.
and it might come from
your
your
head
back
or exactly.
Yeah, right.
So you're kind of...
And then so then after that, say it's unwound.
Yeah.
Then do you go to the place where you unwound from?
Yeah, I typically follow the pattern, and then the body will sort of redirect you to the next place, and then the next place, and then and you sort of follow that pattern. And
How have you? Well,
yeah.
you can finish that thought.
Well,
I want to ask you another question.
Well, to tie it all in, it's like, so you're contacting the mechanism of the patient, right? And you're doing these different sort of, you're releasing these different strain patterns within the patient. But then there's another layer where you are connecting with, so with like stillness. Like stillness is a big concept in osteopathy. And it's like, like an eye of a hurricane?
Mm-hmm. Where it's very still?
Yeah.
Yeah.
But within that eye is all the energy.
Yeah.
It's the power of the hurricane.
Right.
And the wind and the other things that come along with it are manifestations of that power. So if you can dissolve the power within the eye of the hurricane, you're also sort of dissolving the effects of the storm.
Right.
And so that stillness is really what, when we're working osteopathically, we're sort of allowing the fluid fluctuation of the body, which is through what you're asking about, the cerebrospinal fluid.
Yeah.
It's like through the fluctuation of fluid in the body, and then bringing that fluctuation down like almost like, what a tide, the ocean tide. The ocean tide is always ebbing in and ebbing out, but within that midway is stillness.
Right, you can see that because the waves will come in, and then it just kind of sits there, and then it comes in again, and then it just kind of sits there.
And that wave or that tidal force or that movement is sort of, it permeates through all existence. It's sort of this, I think it's part of the universal life force, vital force energy. It has this sort of innate expansion and contraction, and that's seen through osteopathy through the lens of craniosacral osteopathy, which we call the primary respiratory mechanism, which is this sort of innate expansion and retraction that happens in the body, and the osteopath is working with this mechanism to get the body down to a still point, and within that stillness enters the life force energy to dissolve the strain. And so the fulcrum is part of creating that balance point.
So then I would say, in the stillness, yes, in the stillness, then when you when you get to the stillness and you can relieve the tension that's there, then blood will come to that area. It'll be nourished again and can regenerate.
Yes. And so a good analogy of that too with osteopathy is like we're kind of we're giving space for the body. We're opening up the body, we're opening up the systems, we're opening up the joints, we're releasing tension of the ligaments, we're releasing the fascial systems. We're allowing space to come, to be opened up where things have been twisted and compacted and contorted or whatever. We're giving the body a space, and within that space, then the body is able to send the nutrients and everything to heal and regenerate. So I like to talk to my patients a lot with this analogy of like, as if like you have a garden, right? And every day you go and you water your garden with your garden hose. But let's say there's like a bratty kid at the end of the hose who's holding the kink in the hose, right? Mm-hmm. And then all of a sudden there's no water coming out your hose and you can't water your garden. Well, it's very similar with the body. When there's distortions and compressions and compactions and strains and twists and whatever, then you're not properly irrigating your system, and then symptoms and disease can manifest.
Now, what are the different ways that people would become contorted and twisted?
I mean, yeah, it can start as early on as embryological development, when we're developing with with how things develop. It's very common that people end up with congenital issues at birth. And then you can, kind of continue from that. Let's say, when you were young, you fell and hit your head on the coffee table, at a young age. And that disruption, the mother might think, oh, my baby's okay, like it was a small bruise and then whatever. But like that type of force can have an impact, and it can also show up even years later. It doesn't necessarily maybe show up in the moment, but that sort of force and then that compaction can cause long-term effects later on. So there's traumatic force, there's embryological growth development that can happen. There's emotional components to, like, emotions can also throw things off within your physical body. Stress is a good example of, stress I think is the number one killer, really. Mm-hmm. Like it can really create a lot of...
And that's how it's a killer?
Yeah, because it's kinking the hose. It's turning off the system, basically.
Yeah, right.
And so there's emotional factors, there's traumatic factors, there's developmental factors, there's psychological, like all of the ways in which you interact with life can create the environment for your body to distort and sort of become off balance.
One of the analogies that I was taught was that if you take a rock and you throw it into the water, there's a splash. If you have an impact, whether it's by drugs or by psychology, by an interaction with someone else that was disruptive, or a physical force, or a developmental force, or an embryonic force, there's going to be a splash, and that splash is going to be within our bodies.
And it's going to ripple out.
Yeah.
And create other issues along the way.
What do you mean by that?
Like in clinic, let's say, the client is, let's say, complaining of a certain issue, mm-hmm. like they have digestive issues or something. Yeah. And so an osteopath really has to take a informed health history. Like, we really have to look at all the ways in which your past has affected your current condition. And lots of people don't realize how things that happened 10, 20, 30, 40, 50 years ago are still actually impacting them today. Mm-hmm. Like, remember the story about you were searching for an answer for your neck.
Yeah, because I got hit with a baseball in my temple when I was about 17, and it knocked me out. So it was a very strong hit. And when I woke up, I thought, this is going to impact my whole life, whatever happened right here.
And it did.
And it has. And it has, in fact, just a few years ago, maybe 5 years ago, my teeth on the other side all had to be capped and everything because of that impact. It actually...
It distorted.
It put so much stress on these teeth that they broke down.
They failed, yeah.
But it took them 40 years.
Yeah. Well,
they're very
They
tough.
were resilient.
They were resilient. They were very
and
resilient.
that's what I'm talking about. Like, it just...
Yeah, you just
it's
have no
endless.
idea.
And that's why osteopathy is so interesting, because we make all of these connections and we form these interrelationships and we understand the interconnectivity between things, and we can see, you know, how something at a distance can affect the issue. Like,
I mean, even the stress today in our society is creating stress within people's bodies, I imagine.
And fear.
And fear. Yes, fear is a big one.
Fear.
But
yeah, it's creating an environment for stress and for the breakdown of the body.
Yeah.
And so, I mean, it's great to have osteopathic treatment like on a regular, ongoing basis, because we're always being kind of bombarded by things on a regular. So it's good to kind of have a maintenance where you're just kind of always keeping your body in check and always sort of allowing things to release and dissolve, and so things aren't manifesting later on. Right.
Keeping it treating it in an acute stage instead of in a chronic stage, where I imagine it becomes impactful for more systems in your body.
A lot of compensating factors. Yeah. And so it really is a lot about like, so when a client comes for treatment, there's so many factors. Like, it actually was interesting the other day because I had a new client come in, mm-hmm. and he was telling me how, he used to throw his back out. 20 years ago, he threw his back out for the first time, and that was such a impactful moment for him, because he realized, like, wow, like, this is such a, like, it can be a very debilitating issue, right? And I think a lot of people suffer from that.
I think by the time people are middle-aged, 95% of people have had low back trouble.
Yeah.
So, yes.
And so, he was telling me about that, and he said that more recently, the reason why he came for the appointment was because he started sort of having these feelings that was a possible thing that could occur again, that he felt that there was some pain in his hips and his back again, and that there was a bit of a instability, and he kind of had apprehension that maybe he was going to throw his back out again. So in the history taking, we talked a lot about his history and everything, and then he had mentioned that he had this chronic sinusitis, and that it was affecting him on a daily basis, and that he was taking Tylenol sinus every day. Mm-hmm. And so I was like, ooh, every day? And then I made this correlation. I said, well, how long have you felt that your back has been re-aggravated again? And he said, well, about, 6 months to a year, it's sort of been on my mind. And then I said, okay, so when did you start taking this Tylenol for your sinusitis? And he said, oh, actually, it was around the same time. So we don't realize the effects of the medications we take, or the dietary things we do, or the drinking, or the food-related things, mm-hmm. or there's a lot of things that are affecting our physical body, and we, as people, normal people, we don't really correlate these things, right? And so I saw that this continual taking of Tylenol, which is it's not supposed to be taken on a regular basis.
No, it's a crisis control.
Yeah. And so he was creating an environment a disruptive environment in his digestive system, which was then on a feedback loop neurologically with his lower back and creating his lower back pain. So
how's he doing?
Well, I only treated him that one time, and it was it was last week, so I don't know.
Okay. More work to be done there.
More work to be done, but that's osteopathy.
Yeah. Well, the work that you've done on me has been very helpful because I had major surgery in my abdomen. I would come to you just really because I knew that was probably a good idea. Not necessarily because I was suffering so much, but I didn't want to suffer anymore. I'd suffered enough, and I didn't want to suffer anymore.
Yeah.
And so I thought coming to an osteopath would be beneficial to keeping myself in check, right? And you were telling me that sometimes my liver was displaced, and because it was being pulled by scar tissue, I imagine. And so you were working to alleviate the tensions that were straining my abdomen this way and that way. And I don't know how many times I came, a whole bunch of times. And it was very beneficial, yeah, and you worked in my abdomen, and then you worked up here too, because of all that impact that I had so many years ago. It's still affecting me.
Yeah.
But less than it was. I mean, I don't have any pain anymore,
Right.
really, to tell you the truth. As long as I take care of myself and have osteopathic treatments and do Pilates.
There.
And and have some lumbar support because I'm a shrimp and I don't fit in airplanes and buses and things like that. I'm good, but I have to be really vigilant.
Yeah, and I'm amazed. Like I've been having osteopathic treatment now for, I guess, roughly 10 years consistently.
Mm-hmm. And what's that done for you? Besides stopping you from breathing.
Well, first of all, it's really released a lot of traumatic guarding mechanisms in my body.
And in consequence, there's a consequence to that, right?
Yeah.
Psychologically, there must be a consequence to that.
To releasing, yeah.
Yeah.
Of course, yeah. I mean, I think, yeah, I mean, it's, I feel like these treatments over time have allowed me to come into more of the essence of who I am, because I'm not disturbed and disrupted by these twists and these forces that are sort of not allowing me to be in my center. Mm-hmm. So trauma, many years of trauma over a lifetime, you have so many different guarding mechanisms in place where it's not allowing the full expression of your spirit, because your vitality is not being expressed, because things are being blocked. And so definitely the more treatment I get also influences my osteopathic practice. And I become a better practitioner for my clients because I have more of a connection to source.
Right, right.
And before, I would say that my connection was lost through life.
Right.
And not
inevitable. It's inevitable.
Yeah.
Isn't it? Yeah.
And it can be, yeah, like we said before, it could be like a snowboarding accident that threw out my back is only one physical manifestation of, it's sort of like the physical manifestation of the emotional, mental, spiritual trauma. Like, it's as if life has to show you.
Physically, we fall apart differently.
You know?
That's what I find interesting, is different people are impacted differently. So there's an individual response to trauma and spiritual trouble and psychological trouble. And so not everybody responds the same way. It is funny, though, that everybody ends up with lower back troubles. I wonder if that's because we sit so much now in our culture and work on computers.
Yeah. I mean, I think apparently the low back is also in relationship to money.
Oh, is that right?
And the stress of money and financial strain.
Mm.
I mean, most of us suffer from that.
Yeah.
And so most of us suffer from low back pain.
Ah.
I mean, they do, I don't know who says that, but there is a
Right.
correlation.
Mm.
But also, yeah, like you were saying, like, there's going to be a physical manifestation of your mental, emotional, psychological trauma.
Mm-hmm. There's
And
going to be a physical manifestation of it.
Whether it's a disease or a fall off a ladder or a snowboard injury, whatever you want, it's just a physical manifestation of the imbalance that's happening on a psychological and emotional level.
Yeah, and so all the work we do to center ourselves and to also do exercise to keep ourselves strong.
Yeah.
So that we can, if our musculature is strong, it's more likely to keep us upright.
Yes.
And so all these things come into play. And lots of people now, they're so focused that they sacrifice themselves to it. And the problem is when you sacrifice yourself to whatever it is, it might not be work, but whatever it is, then I've learned that sacrifice is taking away my chance to be of service to someone. Yeah.
Right.
And that's not, that's one of the commandments, is to serve your neighbor, to love your neighbor. So if you're not spending the time that's necessary to keep yourself as connected as you can and as upright as you can, you will suffer, but so will the people you love.
Yeah.
Yeah.
Exactly.
Mm-hmm. No, it's really important, all of this.
Yeah.
And it feels important to me, that's for sure.
Yeah. And yeah, all of these things are sort of ingrained in osteopathic practice. So it's hard because a lot of my clients or people that I meet or, social events or whatever, everyone wants to know, a lot of people haven't heard of osteopathy. I mean, it's very common that people are like, oh, what is that? Is that is that like osteoporosis? Or like, is that a bone doctor? Like, because they associate osteo, right? But the word osteopathy, I think, comes from osteome, which is supposed to mean like mind, body, and spirit connection. So everyone is always like, oh, what is osteopathy? And immediately, and I think most practitioners kind of freeze in their brains a little bit, because it's just like, how do you describe it in one or two sentences? Because it just encompasses like so much vastness.
Well, you did it in an hour.
I did it in an hour, and I think I only
That's
really
pretty good.
I think I really only touched on like
the
surface of it.
Yeah.
And I was like, I was rereading my thesis in the last few days, because I haven't looked at it in over 3 years, because it was like a manifesto that I created, and I just like, it just broke me in so many ways, and I couldn't imagine going and looking at it again. So before our podcast, I was like, I gotta reread my thesis. And then I'm realizing, like, it's just such gold. Like, there's so much great stuff in there, and I hope one day that I can translate it into something more palpable for people to read.
I hope so too. I think you will.
Yeah.
Every, one day at a time.
One day at a time.
Yeah.
Yeah.
Well, thanks, Candice. It was a pleasure to talk to you about this.
Thanks for having me.
My pleasure.